It has been 2 years, exactly 2 years, since the World Health Organization declared COVID-19 a global pandemic. Quickly, the world came to a halt as leaders raced to control the spread of the virus.
Over 6 million people across the world lost their lives, and another 453 million have been infected with the virus, many of them still suffering symptoms these years later. Advocates in the U.S. are now calling for a day of memorial to remember those who died because of COVID, and the families, of course, who will never be the same. The World Health Organization had this to say about our continued fight against the virus.
The virus continues to evolve, and we continue to face major obstacles in distributing vaccines, tests, and treatments everywhere they are needed. The pandemic is far from over, and it will not be over anywhere until it's over everywhere.
There is hope on the horizon. Cases and hospitalization rates are dropping in the U.S., prompting many states to reevaluate their COVID protocols, dropping mandates that have been in place since 2020. NBC News medical contributor Dr. Natalie Azar joins us now to look back on these last 2 years. Good to have you with us. Remind us how far we've come in the last 2 years, how much we've learned, and also how much we've lost.
You know, I think you can categorize it two ways, you guys. I think there are things that we did really well, and there are things that we clearly messed up on. You know, pandemic preparedness is composed of a lot of different components: epidemiology, therapeutics, prevention. I think we did a great job mobilizing the scientific world community, right? The collaboration between government and industry, Operation Warp Speed, those were all great things. Things where we clearly had deficiencies, it exposed the deficiencies in our public health infrastructure. Messaging was an issue. Equity has been a huge issue. And I think something that is really, really important right now is funding, right? We had a $22 billion ask from Congress. We had $15 billion stripped from the next package. You know what they're anticipating? In 1 month's time, we're going to have inadequate money for testing. By May, for monoclonal antibodies. Further than that, for Paxlovid, the antivirals. The funding of this is so important. As Dr. Tedros said, it's not over anywhere until it's over everywhere. Only 14% of folks in low-income countries have had one dose of vaccine. So while we've made great strides here in the U.S., guys, globally, this is not behind us yet. It's not.
Absolutely. Let's talk about turning points. Of course, the vaccine. What stands out to you when you look back at this 2 years?
Oh, my goodness. I would say the vaccine, right? Yeah. I mean, and all the credit goes to the former administration for Operation Warp Speed, and the credit goes to this administration for being able to deploy vaccination across the country. But as I mentioned, and as we all know, there have been incredible hindrances to getting we have the majority of our population vaccinated, but still populations, a significant percentage who have not been vaccinated. I always say, we just can't look at this pandemic from just the United States eye, from the Western Hemisphere's eye. This is a global pandemic. And so, we really have to keep our eyes wide open moving forward. Even though it looks good here, it looks great in New York City. We're sitting together. We're not wearing masks. And I hope that lasts. But, the virus is tricky. It's tricked us before.
And Omicron taught us how quickly things can change.
Absolutely rapidly. Literally from a week to the next.
And we weren't ready. So with that, I ask you, what do you think is next for COVID? And are we prepared if something like this happens again? Did we learn a lesson in these last 2 years?
Well, that's the thing, which is why the funding issue is so frustrating, because you have to be looking forward with your eyes wide open. And it's shocking to me that anyone in this country would assume that we have it all behind us, given what's happened before. Look, I'm very encouraged that the vaccinations we have are still holding up and are still effective against the new variants that come. But, again, like we've said before, it's a sneaky virus. I hope it doesn't throw us a lot of new curveballs. I think the United States and certain areas, of course, of Europe are headed in absolutely the right direction. But we just can't strip everything away, including money, all at one time. I think we're really we're gonna surprise ourselves in an unfortunate way in a couple of weeks to months, if that's the case.
Let's hope that is not the case.
Exactly.
And thank you so much. I mean, what a milestone for us all to look back on 2 years later.
I think a lot of us are reflecting on where we were 2 years ago today.
What you saw, what you remember being the changing point for you, the NBA.
Yes, I remember watching that game and going, uh-oh.
Yeah, exactly. Yeah, a lot of people probably do. All right, Dr. Azar, thank you so much. Great to have you with us.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.